Hello, I'm Dr. Jeffrey Tate. In the next few minutes, I'll give you the latest medical information about overweight and its treatment. Overweight has increased dramatically in the United States in the last 15 years. It is now the #1 cause of mental and physical illness in the United States. Overeating of carbohydrates in particular is the main cause of overweight. Over the past 50 years, we've been eating more and more carbohydrates, especially since the food pyramid was created about 1980. Carbohydrates are all broken down to sugar in your intestinal tract. This sugar is absorbed into your bloodstream. To control your blood sugar level, your pancreas then secretes more insulin, which then pushes the excess sugar into muscle cells and into your liver cells. Insulin, though, is also the main signal for you to create new fat cells, and it tells your fat cells to grow larger by absorbing more fat from the bloodstream. Therefore, the more carbohydrates you eat, the more insulin you create, and the more fat you store. By reducing your carbohydrate intake, you will reduce your insulin and reduce your fat storage. Lower insulin maximizes your metabolic signals to lose weight. That's why a reduced carbohydrate diet is best for weight loss. The trouble with any diet, though, including this one, is resisting those carbo cravings. Research has shown that almost no one can stay on any diet for more than a few months. After that, we all drift back to eating too many carbohydrates. Potatoes, breads, pasta, and sweets are just too irresistible without help. Almost everyone has carbo cravings. They are probably part of our genetics as a species, dating back from a time when carbohydrates were scarce. Also, recent research indicates that carbohydrates are somewhat physically addicting, similar to codeine. In other words, the more carbohydrates you eat, the stronger your urges are to eat even more carbohydrates. Not only are carbohydrates addictive, stress makes us want more carbohydrates, just like an infant wants a pacifier to relax. Boredom, tension, loneliness, fear, worry, anger, sadness, any of these feelings can drive us to eat more carbohydrates. Stress also increases the hormone cortisol in our bodies, which then further increases the fat storage power of insulin. Specialist physicians now recognize that almost everyone with a weight problem will need a medication to control their carbo cravings as they lose weight. Fortunately, we have safe medications that work well and can be used as long as necessary. A lot of people have heard bad things about so-called diet pills. A couple of years ago, there was a big scare about fen-phen causing heart and lung problems, and that particular medicine was taken off of the market. Also, a lot of people think they should be able to control what they eat with willpower alone. But research has shown that our brain programming for carbo cravings is so strong that most of us are unable to overcome them for longer than a few months. After that, again, we drift back to our old ways of eating and regain all the weight we've lost. The current thinking among specialists in overweight treatment is that medications to reduce carbo cravings will be needed. Fortunately, we have modern medicines that are safe even for lifelong use. By using these medicines, most people can attain and maintain a healthy weight. Another problem leading to more overweight is reduced muscle on our bodies. Because of modern conveniences, we're all exercising less, so we have less muscle. The problem is the less muscle you have, the fewer calories you burn every day. That's why it's important to include light weightlifting a couple of times a week in your healthy lifestyle. This will increase your muscle mass and increase the calories you burn all week. The modern treatment of overweight and overeating is based on the information you've just learned. A low-carb nutrition plan, medications to control carbo cravings so you can stay on the nutrition plan, and light weightlifting to increase muscle mass. At Tate Healthcare Specialist, we know how to provide you with low-carb nutrition, medications to help control those carbo cravings, and counseling to help you stay on the program and to teach you how to do the weightlifting. In fact, we have the most expertise in the area in treating serious overweight. Most of our patients are losing about 15% of their starting weight in a little under 4 months. That's losing over 30 pounds if you start at about 200 pounds. And they're losing without any health problems, and they're enjoying it. Get started on the new improved you today. call my office at 1-800-889-4319 to make an appointment or simply for more information. You can also pick up one of our brochures on overeating and overweight displayed at this kiosk. If you would like, visit my website at tatehealthcare.com, where you'll see lots more information about overweight and our treatment program, as well as an online symptom questionnaire that you can fill out and submit to me, and which I'll get back to you about with free feedback. Thank you for watching this. Look forward to helping you soon. Bye-bye.